Aubagio tablets is used by adults to treat multiple sclerosis. Active ingredient teriflunomide. It is not a cure for multiple sclerosis, but is thought to work by decreasing certain immune system cells, lymphocytes, which can attack the nerves in your brain and spinal cord. This helps decrease the number of flare-ups, relapses, and may help slow down physical problems caused by multiple sclerosis. Indications. Aubagio affects the immune system and reduces swelling and inflammation in the nervous system. Aubagio is used to treat relapsing forms of multiple sclerosis in adults, including clinically isolated syndrome, relapsing remitting disease, and active secondary progressive disease. How to use. Before you start treatment with Aubagio, your doctor may perform tests to make sure you do not have tuberculosis or other infections. Follow directions on the prescription label and real medication guides or instruction sheets. Your doctor may occasionally change your dose. Use the medicine exactly as directed. You may take Aubagio with or without food. Your blood pressure will need to be checked often. Teriflunomide can lower your blood cell count. Your blood will need to be tested often. Your treatment may be delayed based on the results. Use your adult dose for multiple sclerosis 7 mg or 40 mg orally once a day. Contraindications. You should not use Aubagio if you are allergic to teriflunomide or leflunomide, or if you have severe liver disease, or you are also taking leflunomide. Don't use Aubagio if you are pregnant or may become pregnant. You will need to have a negative pregnancy test before starting this treatment. You're not getting pregnant until after you stop taking this medicine and undergo a drug elimination procedure to help rid your body of this medicine. Stop taking Aubagio and call doctor right away if you miss a period or think you might be pregnant. To make sure this medicine is safe for you, tell a doctor if you have overhead, liver or kidney disease, high blood sugar, high blood pressure, skin problems when taking medicines, a fever or uncontrolled infections, brain problems, tuberculosis or nerve problems such as neuropathy. Use birth control to prevent pregnancy while you are taking this medicine. After you stop taking Aubagio, continue using birth control until you have received blood tests to make sure the drug has been eliminated from your body. Precautions. Avoid being near people who have cold, the flu or other contagious illnesses. Contact your doctor at once if you develop signs of infection. Do not receive a live vaccine while using Aubagio and for at least 6 months after you stop taking it. The vaccine may not work as well during this time and may not fully protect you from disease. Call a doctor at once if you have signs of liver problems, upper stomach pain, loss of appetite, dark urine or jaundice, yellowness of the skin or eyes. After you stop taking Aubagio, the drug could stay in your body for up to 2 years. You may need to be treated with other medications to help your body eliminate teriflunomide quickly. Follow doctor's instructions. Aubagio side effects. Get emergency medical help if you have signs of an allergic reaction to Aubagio, hives, difficult breathing, swelling in your face or throat, or a severe skin reaction, fever, sore throat, burning eyes, skin pain, red or purple skin rash with blistering and peeling. Stop using this medicine and call doctor at once if you have numbness or tingling in your hands or feet that feels different from your multiple sclerosis symptoms. Trouble breathing, nervousness and cough with or without fever. Signs of infection, fever, chills, body aches, nausea, vomiting, feeling tired. Or liver problems, upper stomach pain, loss of appetite, dark urine, jaundice, yellowing of the skin or eyes. Common Aubagio side effects may include headache, nausea, diarrhea, thinning hair or abnormal liver function tests.